Man, I'm excited. I don't know about the rest of y'all, but this is really, really, really good stuff. So let me just, as my shy colleagues get ready to grab their tents, you're supposed to put it up, not that. So you've sold me. We want to participate in the emerging new national recovery. What was the full name of that?
The National Disaster Recovery Framework.
We want to do that. And I'm hopeful that there actually is a thing that we can grab on. So in other words, you're saying that there is this vibrant thing that is a new conversation about this and that we might be able to get in. Then the question then is so how? How do we do that? How do we educate this disaster recovery assistant network about the health stuff? Will these people listen to health? Do we have to speak a new language to get them to pay attention? What's necessary for us to get in the game and be paid attention to?
Yep. So one issue is, yes, so within the National Disaster Recovery Framework, and Barry actually alluded to this, is there are recovery support functions, and there is a recovery support function that deals with public health. And so that is a venue. But what I would argue, that's one of our challenges, is we need to understand how things like health and safety and planning are cross-cutting. And then I think that's one of my concerns with the National Disaster Recovery Framework, is it could still lead to that stovepiping of programs and policies. So you've got the kind of the public health policies, you have FEMA's policies and HUD's policies, and then you have state policies and so forth. And so I would argue that one strategic point of entry that exists, and there's a way for you to engage, is through the recovery support function framework. But I would also argue that we need to collectively engage in advocacy. For example, there isn't a mandate to develop pre-disaster recovery plans in this country. They suggest or encourage it. Now, of course, anytime you talk about a mandate, obviously there needs to be resources in order to achieve that. But that's another challenge that I think was alluded to, is that there's a lot of emphasis placed right now on the development of post-disaster recovery plans, as opposed to emphasis placed on the development of pre-disaster recovery plans.
Did you want to say something, Jay?
Yeah, I'm going to elaborate a little on what Gavin just said. You know, like the earlier national response framework, which has these emergency support functions, the NDRF has 6 RSFs, recovery support functions, one of which is health and human services. Now, each of these support functions, as is also the case with the response framework, has a designated agency that is in charge, and then various other agencies that report to it. So Health and Human Services, logically enough, has that particular support function. I think one of the things to be concerned about is the possibility, and Gavin just alluded to it, about stovepiping, that each of these 6 framework support functions goes off in its own direction. And so the people who are doing RSF 1, community planning and capacity building, which is under the domain of FEMA, may not be doing much communication with the folks who are heading up the support function for Health and Human Services.
We're sorry. Your conference is ending now. Please hang up.
Man, don't stop, bro. You're on a roll.
I'm on a roll. I'll keep going. So, I mean, one piece of advocacy clearly is to stay on the case of the federal agencies involved, to keep these support functions talking to each other in the joint field offices and in the bureaucracy about how they relate to each other. Because the tendency for the centrifugal forces to take over and split them all in their own directions is pretty heavy. So that's something to pay attention to.
Robert, are you on this?
Yeah, I just want to say the framework. I mean, I'm glad we're talking about this. It's really it's a start. It's meant to encourage the coordination of all the federal agencies that are involved in recovery, and a lot of it needs to be still needs to be fleshed out. Mm-hmm. And so I'll humbly suggest that a really important role that this committee can serve is to help to do that. for the Health and Human Services, both in terms of fleshing that out and, as we were talking about here, trying to think about how it coordinates with all the other activities.
All right,
so
we've
the framework is there.
We got a bunch of tent cards. Let me just ask Autumn and Lauren. So just let's don't lose. I want to make sure, and if by any chance, which we, because you're not going to stay up all night, but if we can find from them something for tomorrow's conversation that gives us a little insight into that report, maybe the members of the committee that already lived this, where we can find that link in terms of that effort and HHS and what they're doing or not doing there, so we can go through that. But we're going to need you guys to help us on that piece. So that's to be concluded. So
Okay,
everybody was.
The NDRF you can download online, by the way.
But I mean, so with that, we just got to zero in the part about. I just want to zero in the part about HHS.
Yeah.
Who's doing what? What have they said? Have they submitted comments? Anything that we can sort of get a leg up. We're just going to go right. Everybody almost had their thing up at the same time, so we're going to start it, Dan.
Still? There we go. So I wonder if we have just 2 minutes for Gavin and Rob just to talk back and forth, because I saw a bit of a tension there between, in a sense, Gavin's description that we need to have new data and political power to change sort of policy direction, and Rob's imperative to us to sort of decentralize and get things back to the local level. And I wonder if you could just take 2 minutes right now and talk out loud to each other and have a conversation. Is there a tension there between the idea of the impossibility or difficulty of changing things at the national level versus the need to push things back down to the local level?
Yeah, well, I agree with Rob in the sense that we need to think about decentralization, but and also hold local and state governments more accountable. We often say that FEMA is at fault for doing certain things. Well, oftentimes local governments make policy choices that place people and property in harm's way. That said, we have programs like the National Flood Insurance Program and post-disaster relief that incentivizes them to do it. So, I mean, there's all of these issues that are swirling. Local governments are overwhelmed. They may not have the resources and the wherewithal to deal with recovery. They may not be salient to them as a policy issue. So I think there is some tension there. What I was also describing is the realities, and I think we've all seen it in practice, is that sometimes, or oftentimes in disaster recovery, power, like in fact disasters, uncover long-standing issues of inequity and power and so forth. And so communities that have experienced disasters and states that have experienced disasters have learned sometimes that it does take political power to affect change. Many communities may not have that recognition. So that's a challenge too, and that also begs the question, who should be doing the capacity building and the training? To be honest with you, and I commend FEMA for moving forward with the National Disaster Recovery Framework, but there are a lot of other players that ought to be engaging in the training. For example, social justice groups engaging in a dialogue about recovery, because they full well understand that disasters disproportionately affect people that have access to fewer resources. So I think all of these issues are intertwined, and so I don't know if there's necessarily a tension, but we can try to mix one up or mix it up. I don't know, Rob. You? No,
there are both of our descriptions, I think, are completely consistent with each other. There is a tension that between from the local level to the national level that's shown in Gavin's diagram, but what I would say is, so government has an important role, and all the levels of government have an important role, and the federal government has an important role, and providing money and technical assistance is really important, but it shouldn't be top down. Which is, again, I mentioned again this morning there was a suggestion that we needed a federal czar, and I don't agree with that, because that implies a top down kind of an operation. But you need to. Tension is there needs to be a creative collaboration between those levels. And a slide that I often use that I didn't have in my presentation today is the one that says that the role of government is to send technical assistance and money and then get out of the way, which is a simplification of that. But anyway, I think we're completely consistent that there's important roles for everybody along that continuum.
Yeah, and I certainly agree with that. And I guess one thing I would allude to is, after writing about all of these networks and all of these players in the process, one of the comments that I make at the end of the book is that federal policy ought to, in many ways, allow collaboration to thrive, and allow for diversity, and allow for different ideas, and allow for experimentation to some extent. But then also, as Rob is alluding to, if we're going to actually hold communities and states to a higher standard, we need to give them the resources that allow them to do that. And that's actually that's a big issue that we need to confront. The resources aren't being provided. The resources need to do good pre-event recovery planning. And I would say one just quick caveat is under the proposed Disaster Recovery Act, Senator Landrieu took some of the materials from the book and was going to propose a Disaster Recovery Act, but then we had the economic downturn and she pulled that back. So that's another area of advocacy perhaps to explore, is to get Senator Landrieu to consider putting forth Disaster Recovery Act, which does talk about pre-disaster capacity building.
All right, we're going to end up with David, Robert, and then Barry.
Thank you for that. My question is about the green redevelopment. Oh, there we go. My question is about green redevelopment, and the question is, what is the state of knowledge, in your view, that if we go green, that in fact we do in fact see improved health outcomes? And does that impede local jurisdictions from deciding to go green? That is, if there is a lack of knowledge. Or was Kermit right, is it just hard to be green?
I'm not sure, that's not an area that I've specifically actually studied in terms of the connection to improved health. To be honest, I've mostly been looking at it from the standpoint of economic development. But I'd certainly be willing to try and see what I can find for you on that particular point, unless, do you know of anything? Anna? Not really?
You
Okay.
could argue, I mean, on a national
On a
scale,
national
right?
sc- yeah.
You know,
I mean,
being green is going to be less
certainly-
pollution and less,
Yeah, I
you
mean,
know.
taking it out of the disaster context and just looking at it in a broader, other sense, you know, there's a number of ways of analyzing some of the possible results, at least. One, I know for years, I really admired the work of someone named Mary Nelson, who's in Chicago, where I'm at. She's with a nonprofit called Bethel New Life on Chicago's west side. And one reason I admired her work was she was a fierce advocate for the idea that as we build low-income housing, that it ought to be energy efficient. Now, one of the things that can happen with that is, number one, you know, just improved energy efficiency within low-income housing also means that those people carry less of a burden down the road in terms of paying utility bills, which frees up money for a lot of other things, hopefully health included. But also, you know, to the extent that you are doing a lot of that kind of improvement, this is pure intuition. I have not looked at the studies, but I would think that you're also dealing with some healthier housing options, just in terms of, you know, reduced impacts from other kinds of results as a result, you know, from just bad energy usage in old housing and the like.
Yeah, you know.
I don't know. I mean, I'm willing to explore
What I was
that
really
with you,
trying
but
to
I'm
get
not an
at
expert
was
on it.
whether the lack of knowledge in the
Yeah.
planning profession impedes the ability to, you know, advocate for
Oh, I
for
think
green
that
development.
definitely is
Because there
the
are some
case of it.
studies out there.
Yeah.
Yeah, and I think you bring up a really good point, and that goes to one of the issues I think we've talked about, is that this stovepiping of issues. You know, you often think of the design community, land use planners and so forth, they're often talking about reducing sprawl or energy efficiency and the use of green infrastructure, but sometimes those same communities aren't thinking about the roles that plays in risk reduction, for example. Charlotte, Mecklenburg County, North Carolina, after a flood, bought out a lot of flood-prone properties, turned it into greenway development, reduced non-point source pollution. Prior to the disaster, that the water wasn't suitable for human contact. It improved property values. People became more active. I mean, there's connections across green infrastructure and risk reduction, but oftentimes the people that are advocating for these don't work together collaboratively, right, which in many ways was getting at that network diagram. Communities that don't interact and don't plan together don't even see that there are complementary aims that cut across the environment and risk reduction, social justice, and so forth.
Actually, I'm going to back up into a different answer to your question, because I think I may have been not understanding it in the full possibilities of where we could go with this. One of the studies that we did earlier, a few years ago, about 5 years ago, was called Planning the Urban Forest. More recently, a year ago, David Rouse, our research director, is in the back row there, also helped author another report called Green Infrastructure. And one of the things we did in planning the urban forest, you know, I was thinking of your question initially in terms of the kind of thing Greensburg was doing, because that's what I talked about, and that's more energy and housing oriented. But planning the urban forest is much more about green infrastructure. And we listed a variety of the ways in which the benefits of the urban forest have been documented with regard to public mental health, public health because of the air pollution filtering functions of the urban forest, you know, reduced environmental impacts from stormwater runoff and the like. But a good chunk of that was, you know, public health in the broad sense. And those were pretty well documented. There's a number of studies from folks in the Forest Service and other agencies on that particular point. Now that gets more to, you know, this sort of the green infrastructure side of things with forestry, wetland preservation, that type of thing. But yeah, I do think that part planners understand very well.
Yeah, I mean, a lot of urban planning implicitly has public health goals. We're not just trying to,
Right.
you know, we're not playing SimCity just trying to create maps that, you know, things
Thanks.
that
The
look
origin
good.
of the public.
Right, the
planning
idea is
profession.
we're
Let
trying
me,
to build communities that have
yeah.
households that are healthy, happy, environmentally safe,
Good.
all of that.
Yeah.
I just want to make sure we get all the rest of the questions in real quick. So I'm going to go to Robert and then Barry, and then we're going to slip in Bopper there as well.
Now I do. Back to the part about getting communities to do pre-disaster planning. I want to circle back.
Sure.
And I think I'm hearing everyone saying they don't want a federal czar, and they don't want, or they're not so sure about sort of a federal requirement. So help me think other ways, because lots of places aren't doing it, and lots of places are not going to do it. Is the insurance industry a partner in this? I don't know how many of you have reached out to them. I'm very aware in my home state of California, after the 89 and 94 earthquakes, they stopped offering earthquake insurance. So we're not going to do it. And then the state kind of, hold on a minute now. And you know, you started to see building codes get rewritten and different sort of plans put in place so to lure the insurance industry back. So I'm wondering about insurance industry, others in the private sector who
Sure.
play a real role in development and stand to make or lose a lot of money for this,
Yeah,
and how we can bring them into the picture.
I know Gavin wants to weigh in, but I want to tackle this first. I think there were actually two questions there. One had to do with this federal czar question, and what exactly is the role of pre-disaster planning in kind of a local empowerment sense relative to that.
Well, there is
option.
so that's the first question.
That's-
And I assumed an answer, but maybe the answer is
Yeah, well,
wrong. So
no,
go on.
I actually want to offer something on that. Because one of the case studies we used in this new report, it involves Cedar Rapids in 2008. And one of the things I love that the community development director of Cedar Rapids has said repeatedly, and I've used her in presentations and she's done stuff for us, is that you need at the local level to own your own recovery. You can have all the federal programs you want, but it does not do a lot of good to have the federal government come into a community that doesn't know what it wants. So part of the function of pre-disaster planning is to establish that your community actually knows what it wants out of that recovery when it happens, and can go into that process establishing its own strong voice, because otherwise you may very well get overpowered by all those federal rules and federal this, that, and the other thing. So it's important to clarify what is it that the community wants to accomplish with its own recovery, own your own recovery.
How
I
many
think that was-
communities own their own recovery?
Yeah.
How many communities would you say? Give
Well,
me a
I-
ballpark percentage. 5%?
Or less.
Yeah, probably or less,
that's
yeah.
what I thought,
But you know, nonetheless, I mean, I think she's preaching the right song.
You know, I guess one quick issue is that, and it does go to funding, is that communities become absolutely overwhelmed with the administration of grant programs after disaster. They don't have the capacity to do anything else. In fact, they don't have the capacity just to administer grant programs oftentimes. And so the idea of visioning is you know, it's way down on the list. They don't have time for that. They've got to write the next grant. They've got to implement the grant. They've got to hire staff to do it. So that's one. One of your issue about the insurance, and they're one of the players, of course, in this larger network, and they're often, you know, I would often say that almost all of the players in this network have a role to play, the blame in this, the outcomes that we often get. One of the most recent manifestations is the efforts to alter the National Flood Insurance Program to create an actuarially sound program. That was proposed under the Bigger Waters Act. Now, senators and congressmen and women from states that have a lot of flood-prone properties have pushed back and said, wait a minute, I didn't actually realize that we were going to do that. And so there is a significant pushback on starting to think about these issues of state and local accountability. And my argument has been all along, we need to hold states and local governments more accountable, but we've also got to give them the resources to do what Jim is talking about, to be prepared to deal with it, if you will, take ownership of recovery. And one of the ways to do that is also to build these larger networks, so it's not just the relationship between the federal government and local government in the aftermath.
Yeah,
All right.
you know, also, I just want to add real quickly, one of the benefits of having done some international work is you get a chance to see the way in which we do things with regard to insurance in particular is not set in stone, and in fact is potentially very malleable politically, because people have come up with other kinds of solutions than ours in other countries to fit specific circumstances. And you mentioned earthquake insurance. I did work in New Zealand about five and a half years ago. Very interesting. They don't have a national flood insurance program, but they do have an earthquake commission that is funded by a surcharge on property insurance for homeowners, which then funds insurance for earthquakes and geological disasters like landslides, solving a very different problem than ours. California has actually looked at that model from New Zealand. There are various ways of skinning the cat, and in fact, the way that we happen to be doing it right now is not set in stone forever.
All right, very good. So Barry and then Bopper, and then we're done.
Mine is, again, just a real quick point of information that I think Rob mentioned in his presentation, that NDRF is, well, I would say it's a work in progress. It's very new. But there's a significant connection that I think you probably heard, but just to make sure, sitting where Rob is now earlier today, Commander White, I believe, said that his division, or within his unit of government, is the one that they're talking about, the Health and Human Services recovery support function is that. So to the extent that the committee or staff or anyone wants to get engaged with NDRF going forward, or have recommendations, it's in that realm.
Wait a minute, hold on. See that? Is that you?
Yeah. But just to clarify.
Stand up. Here, come on. You're saving Lauren like all hours of the night. So.
Just to clarify, the Health and Social Services Recovery Support Function, which is one of the 6, at the federal level, the coordinating agency is the Department of Health and Human Services. It's coordinated from within the Office of the Assistant Secretary for Preparedness and Response, in the Office of Emergency Management Recovery Division, and I don't know if she welcomed my pointing her out, but in fact, the director of that division's in the room, and she's probably the person best able to answer that.
Oh, this is terrific. So come on up. This is great. So the question, and I think what obviously what we're also confused on is somebody's got to turn off one. You guys got to turn one off. obviously I know I'm confused, which is not unusual, that Nikki Laurie's office, you know, so can you break down, and by the way, thank you for this, you're wonderful. So what's the difference between you, Nikki Laurie, and how it fits into this versus what Barry said?
Good afternoon. I'm Esmeralda Pereira. I am with ASPR's Office of Emergency Management, and I am the lead for
What ASPR means again?
Office of the Assistant Secretary for Preparedness and Response within Health and Human Services. I am the lead for recovery. I'm the national coordinator. And let me assure you, the 6 national coordinators for the RSFs talk all the time because there aren't many more people to talk to, so we keep each other company. And certainly that's one of the reasons why we really wanted to make sure that we brought the Institute of Medicine together to do something like this in an interdisciplinary way, so that we would be getting information from across the multiple sectors, so that when we come up with recommendations, best practices, toolkits, whatever the final product really looks like, that it will be applicable not just for our recovery support function, but across all of them as much as possible, so that we're speaking the language of not just health, which, you know, from our vantage point, of course, it's going to be central and a key point. But I think Commander White's point that you can't, that's not the language that everybody else speaks. So how do you make it translatable to the housing folks, to the planning folks, et cetera? So we've got our, you know, if some people see green infrastructure as a economic development driver, great, that's fantastic. But if at the same time we can be building those sidewalks, building those trails, having the parkland that will improve the air quality, that's great too.
Okay, hold it. Can you hold us? Barbara, can you mind just 1 second? Can I just play this out with Barrett, and we'll come right back to you. So let me make sure I understand your point. Is this national disaster recovery and assistance framework, this is a big deal. And this is a place, at least for federal, now, so question, for federal, the conversation at the federal level, does it also have a relationship at the state level?
Absolutely.
Okay.
It's pyramid system down to the local level. Yeah.
Okay.
It does. However, I would argue that the program is, well, it still needs to be operationalized, number one. And two, it is very much focused on the role of the federal agencies. I think that the interaction between federal, state, and local needs a lot of work. And it also needs to move beyond beyond government and the private sector and nonprofits. There are many other players that need to be engaged.
Now, will we anticipate? No, you go ahead, Robert.
I was just saying, the important first step of this is at the very least, all the federal agencies ought to be singing off the same page.
Now, but would we also expect, question mark, that if this process at the federal level works well, because this is a new or newly invigorated thing, that the states could or should mirror it at the state level?
Yeah, one thing to understand here, and I think it has been sort of alluded to and hinted at, is the date on the document creating the NDRF is something like October 2011. This thing absolutely got its baptism, its trial by ordeal in Hurricane Sandy. It's the first time that it was seriously rolled out in a major national disaster. So there is, as Gavin just suggested, there's a lot of room for operationalizing this thing.
Cool. So if we get the NDRF to really sing and to really roll, and you also then can make recommendations that this model should work well at the state and local level in terms of the processes, then it sounds like that we on this committee are basically being asked in many ways, as a big part of our work, is to find a way to develop the grammar of coexistence for our constituency within this, and that's a big thing for us. So the issue then becomes, how do we learn what those people who are not us need to hear from us? How do we get our message in there in a way that they can understand? That's what Barry is, if I hear him saying, sort of, again, it comes back to this notion of they talk one kind of speak, we talk a different kind of speak. When we use a terminology around such and such a thing, Cedar says that when we say providers in the social services, they mean something different than medical. So are you in a position to give us at some point your impressions as to how we need to, what the challenges are for us to be able to get our message into this space?
Well, one suggestion is to pick up my book and take it. Well, I mean, with some sense of seriousness. I mean, that's actually oh, look at that, just waving, you're waving right there. That doesn't have all the answers. In fact, I will make a caveat. It is an important issue to recognize is that one, and I'd struggle with this, is two groups that I did not effectively describe in that is the medical community and the military. And I'm guilty of the very thing I'm criticizing.
Okay.
So what it does do is it does, in my opinion, honestly evaluate and critique the National Disaster Recovery
Now, one other thing, and just and then we'll get it to Bopper because he only has so much patience with me. One of the things that we have to, I need you to sort of say true or false. One of the things that we have to do, and we can't get any better than you to tell us, is that we have to say in our report something along the lines that we have had hearings, and we have a finding that health is suboptimally considered by the disaster planning process for both pre and post recovery activities. Therefore, the recommendation that we make based upon this finding is blah, blah, blah. Is it true or not true that health is suboptimally represented in the forum, NDRF for now, that health is suboptimally represented in the conversations on pre and post planning at the NDRF?
Yes. Yes.
I want to say, this kind of we and they. I don't see the we and they. There's a network of actors, a network of organizations that are involved in recovery. There's nobody who's in charge of recovery. We always there's this common idea that that FEMA must be it, but there is nobody. There's all these different groups. The framework is a framework. I think you could say, and it's not that well fleshed out, I think you could say that everybody is suboptimally represented in the framework. Okay. And I think you have an important job to try and flesh out your part of it and to make a recommendation to the people who you communicate with, as well as to communicate to others, to flesh out that part of it, and to be cognizant of the context within which you're operating.
All right, now, Bopper, before you go. No, Barry, did you finish?
There we go. I'm not sure of my fact here, but if I'm right, it's an important one. I believe that Nikki, and I can't remember her last name, Laurie, when she addressed us at the last meeting, said that she had recently inherited the recovery function as well. So to make this full circle, and again, somebody can correct me if I'm wrong, it would be proper to say, I think, that from the experience of Hurricane Katrina a few years ago, it brought about a number of institutional changes at the federal level, and NDRF is one of those, well, probably the central one, you might say, and that Mickey's assignment is the result of some of those shortcomings in the Katrina experience. So that's why the assignment came here to us.
Esmeralda, what is the relationship again? So are you in Nikki's shop or companion?
Yes. I work for Dr. Lurie.
You work for Nikki. Okay, great. Don't go anywhere. You're good. But we've got to get Bopper before he goes berserk.
So let me ask, I'm going to actually revise and extend your remarks, Reed, from your question. And I want the panel to answer this question. I think it's just a nod your head yes or no. Our charge is to talk about post-disaster recovery. Our charge is to find literature and data that support or refute what we want to do. I think, or what we want to recommend. I think, Gavin, your slide with that, the Disaster Recovery Assistance Network, that diagonal graph is very important for us. And I'd like everybody on the panel to nod yes or nod no. Is there evidence and data to support a recommendation from this group starting at one end and going to the other, or starting at the bottom and going up? You went from very broad to medium to local to individual. So is there a directionality to that? And in terms of influence and constructive recovery, and if so, what direction, and what's the evidence and data?
Yeah, so that is a really complicated question. So I thought you said yes, I thought you said nod, but I don't know how you did, so.
No,
yeah.
you wrote the book.
Oh, no, I didn't, when you said, okay, so I can do more than nod. So.
You are relieved from the,
Well,
from
of course,
the prescription to nod. You may actually speak language.
Okay, good. So, of course, the answer is it depends. No, I'm gonna, there's more.
You work for the government, right?
No, I used to, yeah. No, I work for the biggest bureaucracy known to humankind, which is the university. So, anyway, so that network, as I alluded to, is loosely coupled, number one. It changes over time and space. That could reflect a particular network. It could be different in a different disaster, and it can evolve and change over time due to planning. So that's kind of a general way of looking at these issues. And I would say also that what often happens, and I write about this in the book, is that someone assumes leadership in one of those nodes in a particular disaster. It may be a nonprofit, it may be the state government, it may be uniquely powerful or well-positioned and knowledgeable. It could be a quasi-governmental group. So all of these issues are uncertain, and I guess my argument is that we need to think about, and planning ought to recognize that and develop plans that are inherently flexible, that deal with these subtleties. I don't know if that gets at some of your question.
No, you didn't answer it.
Okay, all right. Do you want to try again? Or I'm happy to.
No. I guess I don't mean to sound
That's okay.
silly. That graphic was very powerful, and I thank you for sharing it with us. I'm looking for evidence and data that this committee can base our recommendations upon, because that's what IOM has charged us to do. You and I might agree with something, but that doesn't matter that we agree. It really is what data exists that can support a recommendation.
Yeah. And so in many ways, just to be clear, is that in some ways that's the backbone of the book. And so there's a series of chapters that deal with the public sector, the private sector, and so forth. And so nestled throughout all of that narrative are specific, in some cases empirical, evidence to suggest that they play certain roles. So it's kind of intertwined throughout the document.
Yeah, I would second that. I'll just say very briefly, my experience in over 2 decades of working on this stuff is people push and shove in both directions. And a lot depends on who's doing the pushing and shoving and how big their muscles are.
I guess to refine my question is, which direction or in what situation is it most constructive for recovery?
Well, I guess, well, I think one way to look at this is that these resources that are held by these different organizations, and sometimes they're complementary, sometimes they're contradictory. And then actually, to be honest with you, what happens, particularly in the absence of good planning, good participatory planning that really is empowering, those in positions of power tend to create the rules.
Go ahead,
so, there are roles for each level, and I think they're complementary roles, and if done right, they can actually all help each other. As far as this directionality, I suppose, probably the lower end of that probably needs more empowering, but the degree to which the upper end of it can think of their job as being complementary and change in that direction, I think would also be an improvement. Your comment about data, those of us, and the 3 of us here certainly, as well as a few of our other colleagues in this field, there's lots of case studies out there. They're all qualitative. They all support all of the comments we've made, but where you're going to find data on this stuff, I don't know.
Well, this is great. So let me just close this out by just making sure again that those of us who are not living in this world that you live in every day. So we're again, I'm sorry if we're making you go over things that are like elementary school for you, but this is all new for a lot of us. So at the end of the day, with Esmeralda and Cedar here, forever you'll be knowing this, the whole name. So so just remind us, who owns NDRF again? Just so I remember that. Who owns NDRF?
Well, it's a federal program, and that's one of the challenges, that we need to expand that to the much larger array of players.
But I mean, who is the owner of NDRF?
FEMA will pick up the pen with the rest of us eventually to redo it.
So FEMA,
FEMA's the,
who convenes it? If you go, whose office do you go to? FEMA?
Yeah.
So this is FEMA. So at the end of the day, FEMA owns this thing, and HHS, how many bites at the apple does HHS have in terms of social services and health?
Within the 6 recovery support functions, HHS is the lead for one of them and a supporting agency to 4 others.
So which ones do you have? You're the lead for
Health and Social Services.
Health and Social Services.
We also support housing, which is led by HUD, infrastructure, which is led by the U.S. Army Corps of Engineers, economic, which is led by Commerce and the Economic Development Authority within, and then also community planning and capacity building, which is led by FEMA.
So is social service, so health and social services, that's your lead and you have both?
Yes.
Now, what is the, okay, so community planning.
Community planning and capacity building is one of the 6.
And who owns that?
FEMA.
FEMA owns community planning.
Yep.
So all of the efforts that we in the health side understand so well, which is community planning for health, all of that apparatus can fit into this overall program through the community planning committee.
Yes.
We could have influence there.
I think we can say that.
Okay.
Reed, could I ask, that may not be quite correct. I'm not sure how Esmeralda and the commander would feel about that, but I believe it would be more accurate to say your primary channel is through HHS, or through the Health and Human Services RSF,
Right.
which is Esmeralda.
Right. I'm sorry, go ahead.
Yeah, that's the health, so health subject matter would go that way.
But
But in terms of developing plans at the community level after a disaster, which should include health, then it's that CPCB that's run by FEMA.
that's what I'm trying to get to. So I'm trying to get out of the health ghetto on the community planning and get into the community planning is that's where I'm headed. So you hit it, Barry, as always, you hit it just right. So when you guys go to when you say the health and social services component, who sits on there with you all? Let's reverse engineer the health and let's reverse engineer that.
So each recovery support function has a lead or coordinating agency, and then primary agencies and supporting agencies. And of course, I'm on record, so I'm going to forget that of health and social services, we have 7 primary and 7 supporting. So we've got FEMA, Department of Education, DHS, NPPD, National Program Protectorate Directorate, also the Office of Civil Rights and Civil Liberties within DHS as well. So Education, DHS, Department of Transportation, Department of Justice.
Veterans Affairs, right?
Yeah, Veterans Affairs is a support agency. EPA, Environmental Protection Agency, and DOI, Department of Interior, especially Bureau of Indian Affairs.
Okay.
On the support side, Veterans Affairs, USDA, Small Business Administration, American Red Cross, National VOAD, Voluntary Organizations Active in Disasters.
You said housing is on yours too? No, housing is its own.
Housing.
You're
is
on housing, but housing is
You're-
not on yours.
Right.
Okay. Okay.
And then 2 more.
So we'll get those from you then.
Yeah.
We'll get that, we'll need that list from you. But
Yeah.
then
Yeah, that's in the NDRS. I mean, it's all
That's why I
there.
suggested downloading.
we read the book, okay.
It's all there.
So social so you have your own, are you on it, or you're on it through Esmeralda?
So within Health and Social Services, we identified 9 core mission areas: healthcare, public health, environmental health, also social services. And certainly ACF is a partner in multiple mission areas, but particularly in social services.
Now, just one last thing on the money. So what's the implication for the flow of dollars eventually that will allow leveraged coordination of dollars to solve problems, is there any clout that NDRF will have over funding streams? Or is this just a place where people come and talk?
It could. I guess one of the challenges, two things. One is I would encourage you to think more broadly than the federal government. You know, with the recovery support functions, that is very much a federal government entity, which is an important player, but that's one of many players. The money issue is an important one. But in fact, if you could restate your question, I just lost my train of thought.
So just again, is the NDRF have now or potentially has something to say about the coordination leveragedness of the flows of dollars, or is it just a place where people come and talk?
Well, it could potentially. I guess Commander alluded to this. Is a lot of federal agencies are their policies are pre-described, if you will, in many cases, and so there are chances when you can negotiate modifications after disaster, but in reality, a lot of, for example, FEMA follows the Stafford Act. And it is a set of programs that they tell FEMA what they can and can't do. So this goes back to the issue of narrowly defined grant programs.
But if there is no implicit expectation for leveraging dollars within the legitimate constraints that adults have around congressional budgets and funding, so forth, but if there isn't any sense of leveraging and thinking about how dollars are used and how they flow to solve targeted problems, what's the point of having it?
I think it's, as Rob alluded to, it's a natural evolution. First, the fact that we just have a framework in place, now I think the term operationalizing we've been talking about a lot, that's one way to do it, is to make sure that these programs are complementary. Throughout the recovery support functions, these programs are often contradictory, even within the agency in which one resides. So,
if you were to look at it from a fiscal point of view, I think arguably an important purpose of it is to make recovery more efficient and effective. So to
There's dollars being used
spend money
intelligently.
more wisely.
Barry, just a quick one. We're just.
Just a point of information, and I'm way above my pay grade to talk, especially being in Washington, to talk about the president, but the president did assign to the Secretary of HUD, Sean Donovan, the Sandy, I forgot what it's called, Sandy Recovery Task Force, is that correct?
Right. Which is also worth reading.
Pardon me?
Yeah, you should download that too.
Yeah. And so I think, Reed, to more fully answer your question about what difference does it make, there is essentially an executive order assigning that responsibility that essentially federal departments should be paying attention to, and if they aren't, then I'm sure the president would be unhappy with that, or the White House would be unhappy with that. So it does actually, it does make a difference, I think, even in this early stage of NDRF, because it's the structure of the six that has been described here is the organizing function, but the actual expenditure of funds and reprioritization of funds would be as directed by the larger federal government. And then Congress's action is, you saw a diagram, I don't remember who presented it today, but it showed that HUD was the largest single recipient of the congressional allocation, and it tapered down to really small ones. But that is the mechanism, and conceivably NDRF is the mechanism for.
Well, listen, this was fun. I mean, really fun, and we have Cedar to thank for what happened. So you're a good dude. Esmeralda, thank you. You have one comment you want to make?
One and a half comments. So, the National Disaster Recovery Framework certainly has been thought through at the federal level, but it is intended to be national. There are roles and responsibilities for state, local, tribal, individuals and families, and private sector. But the organizing principles of 6 recovery support functions aren't necessarily carried out at the state level. Colorado, after the flooding, I think they have 15 or 18 recovery support functions. So there's certainly a wide gamut of how those principles get implemented. Also, final point, Dr. Olshansky talked about how there are times during post-disaster recovery when choices have to be made, decisions have to be made, and you don't have information. So I would just ask the committee to think of that when you're looking for a final product. What is the information that's going to help those decision makers make the best choices when they know they don't have all the information they need?
Yeah, you know, I would close this off by just pointing out, as I mentioned, October 2011, when this thing was released, if I recall correctly, so barely more than a year old. The best time to influence the shape and functions and direction of a program is in its infancy.
This is, and what I also am just, but Esmeralda, I can't thank you enough for that last comment, because if we spend a lot of energy on this NDRF piece, you know, would it be just, you know, it's okay, it's important, but the action's really at the state and local level, and why are we, you know, fussing around, you know, and missing this? But what we're getting here is that this sounds like a useful thing for us to at least put in our high in our differential of what we're interested in, because not only is it a national thing, it's also a model for what can happen at the state level. So I think you're saying that. Boy, you guys hit a home run. Thank you very much, and thank you for those who got called up and who did a great job. Now I really can't wait to get to the housing discussion. So thanks, guys. Good job. So now we get to do housing, and now I get a better sense of how the housing thing fits in here. Of course, by the way, Daniel wants you all to remember to stop worrying so much about all this money thing, because he really wants you to be thinking that he's going to ask for you on this NDRF thing to talk about social capital. I'm telling you, man, I'm listening to you. You got me. You got me. Hey, so